We will move on to House Bill 5254. This is by Representative Edwards, an act regarding health and safety, Harm Reduction Center Advisory Committee, and pilot program. Representative Edwards, are you with us virtually?
Yes, I am.
Okay, sir, you have the floor. Please introduce your bill. Nice to hear you.
Congratulations to you, Chairman, and all the new members of this great committee. I really look forward to having this bill heard, as well as many others. And as always, this is another great piece of legislation from the East Bay.
All right.
The purpose of this bill is to prevent drug overdoses by authorizing the Department of Health to create a harm reduction program for people to safely consume pre-obtained controlled substances. Medical supervision will be present to prevent overdoses and to make treatment referrals. That's probably one of the biggest parts. It will save lives and get people the opportunity to hear about and to get into treatment. It requires approval from the municipality where a harm reduction center is proposed. It will create an advisory committee charged with making regulation and conditions to the Department of Health. As everyone knows, the opioid epidemic has greatly increased during the pandemic. In fact, we're at the point now where we have more than one death every day from overdoses. The rate of overdose death in Rhode Island has exceeded over 400 in the last year. Opioid addiction and deaths have touched probably every single family in some way in Rhode Island, including my own. We lost a cousin, and we also lost the daughter of another cousin. This bill, for me, is very, very personal, but if it's passed, this bill will save Rhode Island's lives, and it will allow people who have the scourge of addiction to get into treatment and possibly get their lives going forward without opioids. Rhode Island has been a national leader in opioid abuse programs, and this legislation will continue that trend. I know we have a lot of people to testify, so I'll leave it at that. Thank you, Chairman. Thank you, members of the committee.
Thank you, Representative Edwards. Are there any questions from the committee for Representative Edwards at this time? If not, we'll move to our call-in witnesses. Representative Edwards, I have Representative Bennett has a question for you. Go ahead, Representative Bennett.
Thank you, Rep. Edwards, and thank you, Chairman. Rep. Edwards, you also test the drugs for fentanyl. This bill touches my life also, as you probably know. When they check for fentanyl in the drugs, that right there is a safety margin. What other safety margins do you take to assure that the person's going to be okay after they've used?
Well, they have medical people there who can actually monitor them. So if someone goes into overdose, they will be able to give them Narcan, get them to the hospital, get them the treatment they need for the overdose.
Excellent. Thank you.
Thank you, Chairman.
Thank you. Are there any other questions from the committee? If not, we will start to move on to our witness testimony. I'm sorry, Kathy Fogerty. Representative Fogerty, I'm sorry, I didn't see you.
Oh, that's okay.
Go ahead, Representative Fogerty, you first.
All right, Representative Edwards, I'm just wondering, is there a community that's planning on doing one of these centers now, or are you just opening up the state to be able to do this? It'd be interesting. I think it's a great idea. I'm just wondering where it's going to start first.
There are a couple of companies that are looking in different communities. I really don't want to mention them, but they are being looked at in a couple different communities in the state. And as I said before, the municipality will have to approve before they actually place a no-harm center in that community.
Okay, all right. And I agree with Representative Bennett, Chairman Bennett, that fentanyl is the biggest issue. I think we just saw recently one of the doctors on our talk radio who just lost her son just the other day with the opioid-laced Xanax. I mean, it's just crazy how the stuff, just that little dot of it can kill you. So if people are going to use, I'd rather see them use safely and not overdose.
They're even finding it in
Fentanyl.
cocaine now. So, I mean, they're finding fentanyl in just a variety of different products.
That's unbelievable. Okay, thank you. Thank you for putting this bill in.
Thank you, Representative.
Are there any other questions from the committee? Okay, at this time, we will have our phone-in witnesses. Who do we have, Chris?
Dr. Nunn?
Hello, Dr. Nunn.
Yes.
Yes,
Thank
this
you
is-
so much for having me.
You're quite welcome. This is Representative Casey, Chairman of the Health and Human Services Committee. We have you here to testify on House Bill 5245. You have the floor.
Thank you, Chairman. I want to start by thanking Representative Edwards for bold leadership on this really important initiative. My name is Amy Nunn. I'm Executive Director of the Rhode Island Public Health Institute and also Professor of Public Health and Medicine at Brown. I hold master's and doctoral degrees from the Harvard School of Public Health, and I'm here to testify in support of this bill. It's late, so I will be brief. We led the recent report in partnership with the Providence Healthy Community Office, in which we basically found that this harm reduction center plays a very important role in advancing our progress with overdose in the state. This is an evidence-based solution that has been tried in Canada and Amsterdam, the Netherlands with great success. And I mostly just want to endorse the approach, say that we desperately need it. We're leading the nation in overdose. We're in the top few states. And we know exactly what we need to be doing. And this is exactly what we need to be doing. It's grounded in scientific evidence. We also operate a clinic on the west side of Providence called Open Door Health, and I just want to mention briefly that there are many addiction providers, including our team, who are very willing to do this work. We need to have a legal path forward, and there are many providers and nonprofit organizations that are very committed to doing this work. What we need is a legal path forward and some resources and state leadership around it. So we'd be delighted to be partners in that. And I want to affirm that this is indeed grounded in a scientific evidence base that we and other people around the state and the country have helped build. And we'd be really enthusiastic about it. Thank you so much.
Thank you very much, Dr. Nunn. Are there any questions from the committee for Dr. Nunn? Okay. Thank you, Dr. Nunn. We're going to move on to our next witness.
Lisa Peterson?
Ms. Peterson?
Hi, I'm here. Thank you.
Hi, this is Representative Casey, Chairman of the Health and Human Services Committee. We have you here on House Bill 5245. You have the attention of the entire committee. Please give us your testimony. If you can keep it brief, we would appreciate it.
Will do. Thank you so much for your time, Mr. Chairman and honorable committee members. My name is Lisa Peterson. I'm the Chief Operating Officer at VICTA, which is an agency that provides substance use, mental health, and medical services on Elmwood Ave, Providence. And I'm also the co-chair of the Substance Use Policy, Education, and Recovery PAC. I'm here to offer my strong support for this bill and to advocate for the creation of overdose prevention sites as soon as possible. In the treatment world, we routinely rely on what's called the stages of change model. This was developed right here in Rhode Island at the University of Rhode Island and is an evidence-based model that reflects the fluctuations in any individual's motivation to change any type of behavior. Any of us who have tried to start an exercise regimen or sought to make healthier food choices can relate to the idea that some days we're a little bit more prone to make healthier choices than on other days. So it's important that we tailor our approaches based on where somebody is in their stage of change. If someone is pre-contemplative, not really thinking about making a change, and we really push for a referral to treatment, that's unlikely to yield results. And if they have a quote-unquote failed treatment episode, people can really be reluctant to return to treatment down the road or to believe that they can make the changes that they want to make in their lives. So we need to meet pre-contemplative individuals where they are and offer them ways to reduce their risk of long-term health consequences or even death related to their substance use. That ensures that they have the opportunity to find recovery if and when they are ready. This has become increasingly urgent as we know that 2020 was a record year for overdose deaths here in Rhode Island. In addition to the impact of COVID-19 on access to care, we've seen the inability to practice safer use through the buddy system. We typically, in harm reduction, encourage folks not to use alone. They've had very little choice in COVID conditions. And we're also seeing a changing drug supply that increases the risk of overdose death, and this was referenced by our sponsor. Urine toxicology results at VICTA have indicated an increasing prevalence of carfentanil, which is a fentanyl analog nearly 100 times more potent than its known predecessor fentanyl, and which is often not detected by fentanyl test strips. So even the harm reduction tools that we do have in Rhode Island are ineffective at detecting this. So sometimes this lends a false sense of safety to folks who are accustomed to doing their own drug checking in order to inform their consumption. And as referenced earlier, the presence of fentanyl in non-opioid drugs such as methamphetamines, homemade or pressed benzodiazepines is increasing the risk of overdose in folks who don't identify as opioid users and therefore are not taking those same protective measures. So the task for clinicians who work with people in pre-contemplation is simply to raise awareness. An overdose prevention center would provide a safe environment for us to simply share information about trends in the drug supply, risks of use, healthcare options that can help them stay safe from infectious diseases as well as overdose. And it helps develop trusting relationships so that if someone does move into more of an action stage of change and is ready to access services for treatment and recovery, they have a pathway to that and we can do a warm handoff. We recognize that changing our approach to the substance use crisis is concerning to some community members, and we recognize that change is difficult both for individuals and the system. But we believe that we can collectively move forward from pre-contemplation on this issue to action by convening the proposed panel of experts who can research the logistics of an overdose prevention center in Rhode Island, share their evidence-based findings to help counter myths, stigma, and fear, and ultimately pilot a life-saving program for Rhode Islanders. I'd like to thank you for hearing this testimony. I would like to thank Representative Edwards for introducing it, and I'm open to any questions that you may have.
Thank you very much for your testimony. Are there any questions from the committee? Okay, if not, we will go ahead and move on to our next phone call, our next witness.
Anna Jane.
Hello, who am I speaking with?
Yes, this is Anna Jane Yolkin.
Yes, Anna Jane Yolkin. Thank you very much for being with us tonight. This is Representative Casey from the Health and Human Services Committee. We are testifying on House Bill 5245. We are anxious to hear your testimony. If you could keep it brief, we would appreciate that very much. Thank you.
Thank you, Chairman Casey and members of the committee. My name is Anna Jane Yolkin. I am also a co-chair of the Super PAC, and I work at Project Weber Renew, which is an organization that provides many harm reduction services. I stand here in support of this bill. You know, as many people have already stated what they do and their health benefits. I do want to say that while over 400 people died last year, tragically, of a preventable thing, of a drug overdose, no one has ever died in such a facility across the world. So really, this is a tool that we could implement to save lives. And, you know, some people ask me, like, is this controversial? What do you think? And I really think back to the conversations I've had with many of you all, many lawmakers, who have, you know, shared with me your personal connections to this epidemic and how you all want to see evidence and solutions that can help prevent people from dying. I do also want to share that I worked on a letter with many colleagues that would encourage the governor to implement an executive order to help move this process along. And over 500 people and organizations signed on to this letter. So there's also a lot of support there. And the mayor of Providence did testify on the Senate side as well in support. I do want to add that if we were to go forward with this legislation, I think it's really important that we add in specific language about liability protections, liability protections for the facility that would be operating this, the landlord, the medical professionals, the client, just to make that really clear. And that is something that Senator Miller is working on the Senate side as well in their sub-A. So thank you so much. I think that this is a really good solution that can help save lives, and I'm happy to take any questions. Thank you.
Thank you, Anna Jane. We appreciate your testimony. Are there any questions from the committee for Anna Jane? Thank you, Anna Jane. We're going to move on to our next witness. Ms. Goldman.
Yes.
Yes, Ms. Goldman, welcome back. This is Representative Casey again. We appreciate your testimony on the previous bills. We are now on House Bill 5245 by Representative Edwards. If you could keep your comments brief, we would appreciate it, and go right ahead.
Absolutely. Thank you so much to all of you members of the Committee of Health and Human Services. So as I've said before, my name is Jacqueline Goldman, epidemiologist at Brown University School of Public Health, and my work actually focuses on overdose prevention and harm reduction. Like the other people have stated, creating a harm reduction center is virtually a non-contested and uniformly agreed upon solution that could prevent the deaths of so many people. People have alluded to the fact that no people have died at overdose prevention sites that exist internationally. And I just want to point out that as part of my research, I sit down and talk with people who use drugs and help them prevent and help them identify overdose prevention techniques and goals that would best suit them. And a lot of participants have actually talked about hearing about things like this and really wishing that they existed in our state. So this isn't just something that academics want. This is something that people who use drugs, people with everyday lived experience, could see the benefit for. Every single overdose death is a policy failure, and passing this bill, I think, is a really important step forward in preventing the deaths of so many people. So that's really all I want to say. And you've already heard testimony from a lot of really wonderful and knowledgeable people. So thank you so much.
Thank you, Ms. Goldman. We appreciate your testimony. Are there any questions for Ms. Goldman from the committee? Okay, we're going to move on to our next witness then. Hello, Mr. Pereira.
Hello.
Yes, sir. This is Representative Casey from the Health and Human Services Committee. We have you here to testify on House Bill 5245. If you would keep your comments brief, you have the floor and you have our attention.
Great, thank you. Yes, I'll keep this brief. So my name is Sudisha Pereira. I'm a second-year medical student at Warren Alpert Medical School and now a 7-year resident in Providence. And I just wanted to lend my voice in support of the bill. From what I've seen, or from what the statistics say, Rhode Island in 2020 suffered more overdoses than it's ever seen before. And so the people of Rhode Island are really hurting. And everything from the science to the epidemiology points towards the fact that harm reduction is our best tool towards helping Rhode Islanders get the help that they need to live with opioid use disorders. And so I just want to lend my voice in support of the bill and let you know that here's another resident of Providence just saying that this is, I think, what's good for Rhode Islanders and best for the community at large. So, thank you.
Thank you, Sudisha. We appreciate that. Are there any questions for Mr. Pereira from the committee? Okay, so we're going to move. Thank you, sir. We're going to move on to our next witness.
Brandon Marshall.
Okay. Hello, Mr. Marshall.
Hi, speaking.
Hi, this is Representative Casey. You are on the floor with us for House Bill 5245 by Representative Edwards. You have our attention. If you could keep your comments brief, we would appreciate it.
Thank you. Thank you. I'd like to thank Chairman Casey and members of the House and Health and Human Services Committee for the opportunity to testify today. My name is Brandon Marshall. I'm an epidemiologist and professor at Brown School of Public Health, and I've studied overdose prevention interventions for over a decade. And I'm actually from Vancouver originally, where I was fortunate to serve on the scientific team that evaluated Insight, which is North America's first sanctioned supervised consumption facility and harm reduction center. So I just want to summarize some of the evidence that we found from that evaluation for you this evening.
Thank you.
We conducted in total over 100 studies that evaluated these facilities' public health and public safety impacts. And we found that these facilities save lives, they connect people to treatment, and they improve neighborhood conditions in the areas in which they're located. I led a study that was published in 2011 showing that overdose deaths decreased by 35% after a harm reduction center was opened in Vancouver. Other studies have shown that they increase access to treatment, as I mentioned, and has been discussed. In fact, members of our team found that after Insight was opened, over 40% of clients had entered some form of treatment after 2.5 years of operation. The programs also decrease public drug use and drug-related litter in communities in which they are located, and they have been shown to have no impact on neighborhood crime. In fact, crime rates decreased after the facility was opened in Vancouver. I guess I'll maybe finish by just noting that these programs also save healthcare and taxpayer dollars. A recent report that I reviewed from the Institute for Clinical and Economic Review found that even one facility in Boston would save approximately $4 million a year in preventable ED visits and hospitalization costs. So in totality, when we look at the evidence, I'm confident that a harm reduction center in the Ocean State will save lives, and I strongly encourage the House Committee to support this critical piece of legislation. Thank you for your time today.
Thank you, sir. We appreciate your testimony. Are there any other questions from the committee? Okay, if not, we'll move on to our next witness. Chris, do we have any other witnesses for this bill? No. Okay. Okay, so we have two people who signed up who were unable to be contacted for House Bill 5245. So at this time, I will close the hearing on House Bill 5245. We are going to move